Hello everyone, welcome back. My next topic is normal puerperium. So according to the definition, puerperium is the period following the childbirth. Means soon after the expulsion of the placenta, the period of puerperium begins. During this period, the body tissues, mainly the pelvic organs, will revert back approximately to its pre-pregnant state, both anatomically and physiologically. Here word approximately is used because it will not completely revert back to its virgin state. There will be some difference. Next is duration. I told you the period of puerperium will begin as soon as the placenta is expelled. So that will be considered as the first day, and this will last approximately for 6 weeks. Next is stages. There are 3 stages, that is immediate, early and remote. Immediate stage, that is within 24 hours. Early stage will last up to 7 days and remote up to 6 weeks. So next is involution of uterus. The word involution means transformation of uterus from its pregnant state to its non-pregnant state. So at delivery, the uterus measurement was 20 into 12 into 7.5 centimeter. That is length, breadth and thickness. And its weight will be approximately 1000 gram. After involution, the uterus will revert to its non-pregnant size of approximate 60 gram. Lower uterine segment and isthmus in few weeks. Isthmus is the part between the body of the uterus and the internal os of the cervix. The counter of the cervix will be regained in 6 weeks. And external os will never revert back to its nulliparous state. Next is involution of other pelvic structures. In that, first one is vagina. Vagina will take around 4 to 8 weeks or 6 to 10 weeks to revert back to its pre-pregnant state. It will gain its tone, but it will never come back to its virginal state. Next is broad ligaments and round ligament. Round ligament will take long time due to the recovery from the stretching and relaxation during parturition. Third is pelvic floor and pelvic fascia. Even this will take a long time due to stretching during the parturition. Our next topic is lochia. It is the vaginal discharge for the first fortnight during the puerperium. Means for the period of 2 weeks, this discharge will exist. Odor. It has got a peculiar offensive fishy smell. Color and combination. Depending upon the variation of the color of the discharge, it is named as lochia rubra, lochia serosa and lochia alba. Lochia rubra is red in color. This exists from the first till the 4th day. It consists of blood, shreds of fetal membranes and decidua, vernix caseosa, lanugo and meconium. The next one is lochia serosa. This exists from the 5th day till the 9th day. The color is yellowish or pink or pale brownish. This consists of less RBC but more of leukocytes, wound exudate, mucus from the cervix and microorganism. The third is lochia alba. This is pale white in color. This exists from 10th till the 15th day. It consists of plenty of decidual cells, leukocytes, mucus, cholesterol crystals, fatty and granular epithelial cells and microorganisms. Next is clinical importance. The first one is odor. If it is malodorous. Malodorous means having a peculiar offensive fishy smell. That will indicate infection due to the retained plug or cotton pieces inside the vagina, which will result in puerperal sepsis due to E. coli. The next is amount. If it is scanty or if it is absent, that will signify infection or lochiometra. Lochiometra is the distension of the uterus by the retained lochia. If it is excess, that will indicate infection. The next is color. Persistence of red color beyond the normal limit will signify subinvolution or retained bits of conceptus, which will result in PPH, that is postpartum hemorrhage. Subinvolution means the uterus will not return back to its normal size. Duration. The duration of lochia alba beyond 3 weeks will suggest local genital lesions. Next is changes in the breast and lactation. First is mammogenesis. Here mammary duct gland growth and development occurs. Second is lactogenesis. that is initiation of milk secretion by the alveolar cells. Third is galactopoiesis, that is maintenance of lactation occurs. Fourth is galactokinesis, removal of milk from the gland occurs. Next is general physiological changes. The first one is pulse. Pulse rises but settles down to normal on the second day. However, the pulse rate often rises with pain, after pain, or excitement. The next is temperature. Any rise above 0.5 degree Fahrenheit will suggest of infection of the genitourinary tract. The temperature should not be above 99 degree Fahrenheit within the first 24 hours, and on the third day there may be slight rise of temperature due to the breast engorgement, which should not last for more than 24 hours. Next is urinary tract. There is pronounced diuresis on the second and the third day. The common urinary problems are over distension, incomplete emptying, presence of residual urine, high risk of infection. Next is GIT. There is increased thirst due to the loss of fluid during the labor in the lochia, diuresis, and perspiration. Constipation can occur due to delayed gastrointestinal mobility. Next is weight loss, 5 to 6 kg as a consequence of expulsion of the placenta, fetus, liquor, and blood. 2 kgs during the puerperium due to the diuresis. This weight loss may continue up to 6 months after delivery. Next is blood values. Immediately after delivery, there is slight decrease of the blood volume. This occurs due to the blood loss and dehydration, but this will come back to normal in weeks. There is raised cardiac output which will come back to normal within a week. Leukocytosis occurs due to stress. Hypercoagulability state will persist for the 48 hours. Fibrinolytic activity will be enhanced in the first 4 days. Next is menstruation. If the mother is not breastfeeding, then it will resume in 6 to 8th week. Ovulation. If the mother is non-lactating, then it will occur as early as 4th week. In lactating mother, it will occur on 10th week after the delivery. Exclusive breastfeeding mother, 98% contraception up to 6 week. The physiological basis of anovulation and amenorrhea is due to the elevated levels of serum prolactin, which is associated with suckling. Next is management. To restore the health of the mother, rest and early ambulation means walking slowly. Emotional support has to be given. Diet of patient choice should be served. Sleep. Immunization. Anti-D gamma globulin to unimmunized Rh negative mother who is bearing Rh positive baby. Maternal infant bonding. Postnatal exercise should be initiated. To prevent infection, care of the bladder, care of episiotomy wound, maintenance of asepsis and proper hygiene, immunization with rubella vaccine, TT. The principles of management also include to take care of the breast and promote breastfeeding, to promote the mother for contraception. Next is treatment of minor ailments. So after pain, here pain is infrequent and it is spasmodic pain which is felt in the lower abdomen after delivery for a variable period of 2 to 4 days. So in this case, uterus massage has to be done, ibuprofen can be given, and antispasmodics are given. Next is pain at the site of perineum. So first examine the perineum, then advise the patient for sitz bath and analgesic should be given. Treatment of anemia, supplementary iron therapy should be started and advise iron rich diet. Next is abnormal puerperium. So this includes puerperal fever or pyrexia, puerperal sepsis which includes pelvic pain, fever, foul smelling vaginal discharge. Then there is subinvolution, means the organs, that is genital organs, will not revert back to its pre-pregnant state. Breast problems include retracted and cracked nipples, breast engorgement, mastitis, breast abscess, then failure of lactation. Urinary problem include retention of urine, incontinence, and infection. Venous thrombosis can occur, secondary hemorrhage, puerperal psychosis, and obstetric palsy.
Like my video, please don't forget to subscribe my channel. Thank you.